Hello and welcome to the Downsized. My name is Christopher Durham,
I'm Lorraine Durham.
and together we are the Downsized. This is our regular Downsized dish, which is the series where we talk to people using GLP-1s, working on their disease of obesity, sometimes also with type 2 diabetes, and often a lot of other comorbidities. So we'll talk about that a little bit as well. But we like to bring them on and just kind of give you a snapshot of what people are doing, introduce you to different people throughout the world, honestly, and hopefully learn something. uh, we always like to start with, we're not doctors. I'm not a doctor. Lorraine's not a doctor. Condi's not a doctor. If you're interested in any of these medications, please make sure to talk to your doctor, build a plan that's right for you, and make sure you take care of yourself. Before we jump in, I always like to say like and subscribe. Please make sure you hit the notification bell. That way you get alerts every time we go live or publish a new video. So, Condi Carmack, welcome, sir.
Thank you, Christopher. It's a pleasure to be here.
Well, so tell us a little bit about who you are.
So I'm actually a molecular biologist. I got my PhD from the University of Utah many years ago and pursued a career in research and went eventually into diagnostics. So I have a background in molecular immunology, and I have many papers. I also did some research, and we made the first monoclonal antibody that actually won the Nobel Prize for
Wow.
Jim Allison a couple of years ago.
Cool.
Not too shabby.
Not too bad.
Well, so where do you live? Kind of give us that personal insight into Condi.
So I moved to Houston, Texas, about 14 years ago to run the cancer genetics lab at Baylor College of Medicine. So I'm just south of the medical center in a little town called Missouri City, Texas.
Did you get snow?
We did get snow. It's actually melted, and today was the first day we got over 32 degrees, and we're going to stay over 32 degrees. So we're looking forward to spring this weekend.
Yeah. The South this week got a whole swath of snow. So we got a little dusting here in North Carolina. I think the further south you went, the more snow accumulations there were. So, well, Houston, well, that's a good place to live.
So you have a long career as a scientist, then. That's pretty impressive. We're Condi and I have chatted because most often when I'm doing reporting on the news, and there's so much research going on out there, it takes me a lot of work to get to it. So his education and understanding it, I'm jealous of. Well, tell us, because I know you are also a Terzapatide user. So talk to us about the medication and your weight loss journey.
Yeah, so it actually started a couple of years ago. I was an MSL, or a medical science liaison, for Lilly, and I got interested because some of the oncologists approached me and asked me to talk to Lilly and see if they could get early access to Tirzepatide at that time for their obese patients with cancer. And I did, and I talked to Lilly and tried to get early access to the drug. And so that actually sparked an interest. And later I retired from Lilly and started a website and continued corresponding with some of the oncologists and pathologists that were interested in doing weight loss and weight management as one of the pillars for cancer therapy.
So what has your experience been with Tirzepatide? How long have you been taking it? Kind of what does it look like?
And so about a year ago, I approached my family physician to get on Terzapatide. And I was about 210 pounds. I was a little bit overweight, but I wasn't terribly overweight. And I thought that he would push back on me and probably try to talk me out of it. So I had a long list of things that I was going to counter with. And lo and behold, he just said, "Great, wonderful." And later I found out that he had been taking it for about 6 months and had lost 75 pounds. So
Wow.
he was a convert, and
Yeah.
he encouraged me. The reason that I got on it was I had high blood pressure,
Oh,
and that was actually an excuse for him to write the prescription. So I did go on Zepbound, the Lilly brand, and the only thing he cautioned me about was actually the financial toxicity, which of course is significant for
It is,
the brand
absolutely.
names. So it was over $1,000 a month, and I've been taking it, and now I'm on 12.5 milligrams, um, uh, probably maintenance. So I've lost 35 pounds and enjoy the loss.
And has it helped your blood pressures?
It has, yeah. I'm down. My blood pressure is normal, and I take it every day with an electronic thing that goes to my phone. So I do the weight and I do the blood pressure, and then I bring him, all the results, and he's very happy with what has happened.
that's great. Did you go off of your blood pressure medicine now? Have you eliminated that one?
No, I'm taking less of it, but I
Mm,
haven't gone completely off. I still take it every day.
gotcha.
Well, so everybody that watches always wants to know the like numbers. So how old are you?
Mhm.
How tall are you? Some of those things.
So I'm 72 years old, and let's see, I'm 6'2".
Okay.
So, and now I'm down to 175. So I'm very comfortable with that weight. And I talked to an endocrinologist the other day, and she said, I should maintain that. And she gave me a prescription for actually the mochi compounded Terzapatide. So I'm going to start that in a couple of weeks.
Yeah,
That's exciting.
it'll be much cheaper.
So a lot cheaper. Yes,
Yeah.
exactly.
You have such a background in science. How do you feel about compounded Tirzepatide versus the name brand?
Yeah, so I guess I wanted to start out with the name brand and kind of do the comparison. If you look at how so the incretins, both semaglutide and tirzepatide, they're in a class called incretins, and they're small polypeptides, and they're actually very easy to make. And you get a machine, and you can actually make a lot of them. So the compounded companies are making them properly, correctly, and there really isn't an issue with purity. You could actually purify them away from some of the byproducts and things like that, but purity and uh, uh, there's no problem with those things. So I'm not worried about how they're made or their uh,
Effectiveness, I guess.
anything like that. The effectiveness, yeah, correct.
Interesting. So it's a pretty easy thing to manufacture these peptides.
It is. It is. It's relatively inexpensive to manufacture these at and have high quality.
Well, so and I'll ask the scientific question then.
Mhm.
Both Lilly and Novo Nordisk are appealing to the FDA to call these biologics, and basically what that would mean for us folks that aren't scientists is that it couldn't be compounded anymore. Now there's a whole scientific
Correct.
back end of that, but it would no longer be legal to compound it anymore. Do
Right.
you think what do you are they biologics? Is that a place to stand? Or I am not a scientist, so I don't know.
Yeah. So I could actually do an hour on this, getting into the weeds. But the biologics were introduced into the FDA as a classification years ago, and they're supposed to be large molecules like antibodies. So I was in the antibody business way back when, and they are difficult to make. They are difficult to maintain. The peptides are not hard to make, and they're not hard to store, to preserve. So they weren't designed to be a biological, but there's loopholes in the FDA law that allow them to be classified as such. So the Lilly and the FDA are now negotiating the third generation of the triple agonists.
The retatrutide, yeah.
Exactly. Into the biologics for legal reasons, not for any other reason.
Yeah, well, they don't want it compounded for sure. So no doubt about it.
The whole point.
So I guess third generation are drugs they currently have in development that aren't out yet, like retatrutide, Christopher mentioned. Right. For us non-scientific people.
Oh yeah. And Lilly have many different incretins. They're exploring other mechanisms to get the weight off. They also are looking at insulin to modified insulins and things like that. So there are lots of compounds that are coming out, not just the incretins.
Yeah. I mean, it's an exciting time in the industry there. I mean, there's just so much going on, what it looks like 5 years from now as a patient. Obesity is, my biggest comparison is I think we're basically in the Model T era right now, and 5 years, 10 years from now, who knows what those cars look like.
I completely agree. And it's not just Lilly and Novo. There's going to be obviously a lot of the pharmaceutical companies, the big ones, stepping in to try to get a piece of the pie.
Yeah.
Well, so I'm intrigued because you're a scientist and you have personal experience with the medication. So let's talk about that personal experience a little bit. So the traditional titration pattern that Lilly and Novo have both published is kind of you go up a dose every 4 weeks or so, assuming you're tolerating it well. Talk to me about your process and what was your experience?
I really didn't have any problems. I've had some constipation and minor things that can be cured, with over-the-counter medications. I've had very successful medication history. So.
And you said you're on a 12.5 milligram dose now?
Correct.
And you'll continue that dose, do you think, for your maintenance level?
I think so. The endocrinologist said that the mochi is actually going to come down just a little bit. It's going to be, I think, 11 something, whatever.
Yeah.
And we'll see, if I lose weight or if I'm hungry or, modify the dose depending.
Yeah. Okay. All right.
Well, and that's one of the strategies. So Lilly has, I guess, another round of research around Surmount called Surmount Maintain in the Fields, where one of the doses they're testing is basically you staying at the highest dose you obtained.
Yeah.
So it's staying 5 milligrams and placebo. Those poor guys don't have a chance, but
right.
So do you plan to stay on the 12.5 or the slightly lower mochi dose long term?
Yes, to maintain it. I've tried going off for a month or so, and I tend to gain the weight back, or I started to gain it back. So I see no reason not to. If the price, if there's not financial toxicity, I'm going to maintain.
Gotcha. Okay. All right. Excellent.
Well, so talk to us a little bit, as you started taking this medication, about what you're eating, kind of what your go-tos are. How has this adapted how you are?
Yeah, so I really haven't modified my diet. I probably should eat better and do all those good things that you're supposed to do. But I really haven't changed other than the amounts eating. I do tend to skip a meal or two here and there, but without any hunger.
Do you have a protein goal that you're trying to meet, or you really don't pay attention. You don't have to pay attention. Okay.
No. So I met with the nutritionist from Mochi the other day,
Yeah.
and she kind of chewed me out on that one. So she would like me to do a shake in the morning and stuff like that instead of just skipping breakfast altogether. So there is some behavior modification that I need to.
Well, the scientist that doesn't. So I guess it's hard for everyone, even those of us who maybe know better. So yeah, well, it's good. It's good that you're adding in some breakfast and some protein. So yeah, that'll help for sure.
Surely.
Well, so we also wanted to introduce you to Condi because Condi has a website. So tell us about your website, Condi.
Yeah, so again, I got interested in the relationship between cancer and obesity a couple of years ago when I was at Lilly. And the oncologist wanted to put their obese patients that had cancer onto some sort of drug or modification, try to get their weight down. Traditionally, their obese patients have been going in for bariatric surgery. And unfortunately, at that time, there was a year-long wait for bariatric surgery in parts of the country. And so they were looking for alternative methods, and they had heard about Terzapatide and the remarkable things that it was doing. And so they approached myself and Lilly to get early access. So that was when I first got interested and then started researching the connection between cancer and obesity myself. And I decided to start a website and start creating a community, if you will, to discuss some of the issues, some of the problems. There is a relationship between obesity and cancer in 13 cancers that's recognized by the World Health Organization, the NIH, the NCI, large, groups, organizations that study these things. NIH is actually going to add a 14th cancer, and that is prostate cancer. So after prostate cancer is added to the list, it'll actually mean that there are more than 50% of the cancers that afflict Americans today can be modified by obesity or weight management.
Wow.
Wow. And I mean, it seems like every weekend when we do the news, there's some AI and researcher that's figured out through these large data sets, just more connections that, one guy reading spreadsheets would have never figured out by himself.
So how does obesity, maybe I'm just trying to oversimplify, but how does it link to cancer? Is it stored in fat cells? Like how the fat cells go wrong and that cause it? I know that's
Sure.
Is there like a 5-second answer to a very big problem?
So it depends. It depends on the type of cancer. So I'll take the largest cohort or market, if you will, and that's breast cancer. And within breast cancer, there are different types of breast cancer. There are different types of fat. There's visceral fat and there's subcutaneous fat. There's menopause, postmenopausal cancers, and premenopausal. So the short answer is what is thought to happen at a molecular level is that adipose tissue or fat actually produces estrogen, and the estrogen acts as a fuel for the cancer. So it doesn't necessarily start cancer, but it actually exacerbates it. So it adds fuel to the fire, if you will.
So
that
the
is
extra estrogen can lead to producing cancer.
Well, the estrogen, right? It fuels the hormones actually fuel the breast cancer and ovarian cancer and endometrial cancers. There are other hormones that are produced by obesity or fat cells. Now, it's interesting because, again, it's very complex. This is true for postmenopausal women, but not premenopausal. Fat actually is protective in premenopausal cancers.
Wow. And usually, I guess when I've heard of when people start cancer treatments, the doctor says, "Oh, it's good you have a few pounds to lose because the cancer treatments can force weight loss too."
So again, it depends. It depends on what type of treatment is being done. So if the tumor is removed, obviously you're going to remove some tissue. They usually give, at least for breast cancer, they give endocrine therapy, which is to suppress the hormones. But the interesting part is that endocrine therapy actually produces weight gain. So this actually might be something that if a woman is going on to an endocrine therapy, that they might want to consider, taking Tirzepatide or any of the incretins to counteract that weight gain.
Weight gain. Huh. That's so. You were talking earlier about cancer patients with obesity. So they already have cancer, they have obesity. As they were given Tirzepatide and lost weight, how did that affect their cancer?
So the endocrine or the incretin cohorts, if you will, clinical trials have not been done. So a lot of this data actually, the association is certainly there. We know that this association takes place because of epidemiological studies and also bariatric surgery. There have been millions of people that have received bariatric. So they are a great control group, and you can measure the cancer before and after, after bariatric surgery.
Yeah.
But people are now just discovering the incretin population cohort and starting to put them on. So there are a number of different clinical trials that are officially opening up with semaglutide and also Tirzepatide. But those numbers, we don't have enough data. And remember that breast cancer takes 5 years, 10 years to actually get outcome data. So it's going to be a while before we really have any solid clinical data to go on.
I mean, I know I was looking at the list of various research projects that are in progress or getting ready to be, and there was hundreds. It's amazing how many things they go, ooh, maybe this will work. Let's go test it.
So I guess the thought is, I mean, is there a hypothesis that maybe Tirzepatide, semaglutide could help cure cancer, minimize the effects of cancer? Is that the thinking?
What the thinking is right now is that everyone is different. Every cancer is different. You need to go to your doctor. He needs to work with an endocrinologist. Together, they put together kind of a specific or personalized therapy for you, and then execute that. So one of the questions is, if you're obese and have cancer, what do you treat first? Do you treat the cancer first? Do you treat the obesity first? Or do you treat them both at the same time? We don't know. It probably is dependent on the individual and the cancer and a lot of different things. The severity of the cancer, its staging and things like that, how aggressive it is. So there are lots of things that need to be considered. And I think that people are putting together databases, different cohorts, clinical trials, things like that. Hopefully some of this will kind of come out over time.
So is there the possibility that by With the growth of the incretins, the semaglutides, the tirzepatides, whatever comes next, lowering the obesity rate, is there the possibility that long-term the cancer rate comes down?
Well, that's the intention, is that this is a kind of chicken or egg thing,
Mhm.
that if you have slimmer people, your cancer rate will go down.
Hmm.
So it's preventative as well as reactive.
Preventative,
exciting.
preventative as well as reactive. So that's really interesting. And I think people, me personally, I hear cancer and I think,
And you have a family history, so it's very real to you,
yeah.
right?
So yeah, my grandmother died of colon cancer, and I know lots of women. 1 out of every 8 women develop breast cancer over their lifetime. So of course, I know many women that have had breast cancer, and many of them seemingly fit, active, healthy people. So, I don't think we know why a particular person gets cancer, but if obesity has a direct link to cancer, well, I'll take the Terzapatide forever. You know what I mean? If it helps
Sure.
me not get cancer. So, yeah.
Well, so tell us the name of your website, Condi. I want to make sure we get that in there.
Sure. So it's the name of it is cancerobesityconnection.org.
And when I go to that site, what am I going to find? Tell me about that.
You'll actually see a number of different articles on cancer and obesity. There are links to the NIH and to the World Health Organization. Their opinions as to the connection between cancer and obesity. We have posts. We cover the news, what's happening in the world of cancer and obesity. There are breast cancer articles that talk about specific therapies and how to use weight management in oncobesity. There's actually a new name for all of this new specialized area, oncobesity. So
Say
there,
that again. Oncobesity.
So it's oncology and obesity.
Oh,
yeah,
oh, got it.
it's a
Okay.
hybrid, right?
I think that's
To treat
I think that's a
cancer
portmanteau.
and obesity. Okay. All right.
So, we kind of cover everything. There's links to how tirzepatide works, the mechanism of action. There's a link to the clinical trials if people want to know where to go if they have a particular cancer and the contact name and things like that. There are 27 clinical trials that are being done currently with obesity and cancer, different types of cancer, of course. Yeah.
Yeah. Wow.
Mostly
And
in
so
breast cancer.
So if you guys have been on the live, Condi will comment occasionally, and your is basically the name of the website, right? It's obesity and cancer, I think is your YouTube handle.
Yes.
Yes.
Right.
So if you wonder who that is, this is it. It's Condi that's commenting. Now, when you say we, who is the other person in we?
My comrade in crime is a guy named Rocky McCumber and his wife, Jeannie McCumber. They're down in Alabama. I do the science and the website, and then Rocky handles the business.
And so what's exciting is coming up in the next month, Condi and Rocky are going to start doing a regular segment on the Downsized. Science focused, GLP-1 focused, obesity focused, and plus whatever else. And obviously he has such a deep set of, deep background in all this. So he's going to take some deeper dives. So if there's things you guys are interested in, let us know. And Condi's very open to, taking a look at what the current research is, kind of giving you the benefit of his experience that we obviously don't have. And I don't need to invent
Science.
everything, but I'm happy to introduce you to Condi and give him a platform to talk as well, too.
Yeah.
Yeah, so I'm looking for new topics. What are people interested in with regards to weight loss, obesity, and medicine? Cancer is a subspecialty, obviously, that interests me, but there are lots of other things. The addiction portion of it is especially interesting. I think that has unbelievable potential to be explored.
Well, I mean, it's every week we get a new research on substance use disorder and alcohol use disorder that,
Yeah.
I mean, it just seems like it's going to work for a lot of people.
Yeah.
Yeah.
I mean, I guess just thinking of what people want to know, what I want to know is what things can I do to prevent cancer? Can I do anything to prevent, weight loss? I mean, I guess is one thing, but are there other things we should be doing? You know what I mean? Like obviously no smoking and,
Yeah.
but even down to like a daily level, are there things that I should be doing that I don't even know about?
Well, it's everything that your mother told you to do. Eat right, exercise, get plenty of rest, all of those things,
Right.
the
Thank you, notes.
NIH endorses, and it's true.
Yeah.
Well,
Yeah.
I mean, so, part of the advantage of this whole obesity GLP-1 journey is also for those of us who are adapting our diet a little bit and eating a little bit better and focusing on
Mhm.
protein. Is that going to help as well?
Oh, yeah. Actually, there are studies that say that, just losing a little weight makes a big difference, or getting a little exercise makes a big difference.
Hmm.
So you don't have to go to the gym every day. You don't have to, eat perfectly all the time. Everything in moderation, including alcohol.
Yeah. So all the little changes add up. And even if you're just making little baby changes, it can help.
They do.
That's
They do.
good.
Right.
Yeah. Because
And
I mean, nobody does everything perfectly all the time. I mean,
yeah.
yeah.
And there are some, being in the diagnostics area, there are some very, very interesting new technologies that are coming out to monitor your system, monitor your body for cancer. So I could actually go into, a review of some of those technologies. There's a company called Grail that out in California that will monitor your blood for cancer, and
Wow.
it's still fairly expensive, and it has some issues with its execution. But the idea is there, and it's very sound that hopefully we'll be able to monitor you for
So they
early
could see
cancer.
it. They could see it coming before you might necessarily have the marker for it that a regular doctor checkup would
Right.
maybe.
It's a blood test, and they're looking for hidden DNA in the blood.
Huh. Yeah, I have a friend who mother died of breast cancer, sister had breast cancer, so she had the genetic marker, I guess, for breast cancer and opted for a preventative double mastectomy.
Right.
So when you get down to that kind of a serious of a level, these tests would be life-saving, I guess.
Well, and I know
Yes. Mhm.
just our whole community is really interested in the technology of all of it, whether it be that or a CGM or scales or DEXA scans, or there's so much stuff out there that's just cool right now.
Yeah.
For us
What
non-educated
Well,
people.
so at least for breast cancer, there are what they call susceptibility genes you're referring to, and it's the BRCA genes. And there's
Yes.
a whole family of these, and you can actually be tested for these. Myriad Genetics will do the testing for you. Um, they're about $3,500, and if you're at risk, they're actually very, very good tests to do. But they change, it changes the type of cancer and your treatment.
Yeah. Um, yeah, that I guess the testing is out there. Definitely, if you have a family history or concerns, you can look into those for sure.
Yeah.
So as you can tell, Condi knows a lot about all this stuff. So we're excited to have him, and Rocky do some content for us. I think they're going to do kind of conversational content. So it should be very interesting. Let us know if you guys have anything that you'd like, we'll be happy to pass on to Condi. And if can figure out some content there, but probably once a month or so as we see it. So it should be exciting. Well, let's return back to your Terzapatide journey a little bit, because the question we always kind of like to close with on all of this is you're now at 12.5. You've been on it for a good bit of time. So what have you learned over that time? What kind of advice would you give people?
Well, to try it. It's not going to be for everybody. I had no problems. My doctor had no problems. People I've met and, kind of casually bring it up with, they've had no problems. But obviously, everybody's different. But I think that there is, try it, you'll like it, does apply to it. And just there's a mental hurdle, I think, to get onto it or to try it. And then once you're on the other side, then it's not so scary.
I mean, we have so many people that will comment or send me notes or whatever and go, I've got it in the refrigerator and I just can't, I'm afraid.
Yeah.
And then
is it
they go
because
for
of
it, and 6 weeks later, it's all good.
Is it the needle that they're afraid of, or the?
Yeah.
The needle.
I mean,
Okay.
I definitely had hesitation. I had the insulin syringe and the vial, so I'd never done anything like that before. It was definitely scary.
I think it's the needle. I think it's also Facebook groups and the press and everybody talking about you're going to lose all your muscle, you're going to throw up all the time, you're going to have diarrhea, you'll have to have your intestines removed, just all these, and there are side effects, and you need to work with your doctor to make sure that you manage those appropriately. But if you just listen to all that noise out there, it's a scary thing.
Right. No, I completely agree. Yeah.
So, I mean, we always say manage, work with your doctor, because it does happen. But if you look at the research and this, it's rare. So,
but they have to put it on by law. So,
yeah. Well, so we look forward to you joining us and kind of getting your insights on some of these topics, because it's good to have more good, smart content, and you've got the right kind of experience to bring it to us. So we appreciate that. Again, if you have any thoughts, insights, questions for Condi, let us know, and we'll be happy to pass them on. If not, we look forward to seeing you in next, 3 or 4 weeks. You'll see probably once a month some reports from Condi and Rocky, so it should be exciting. Feel free to comment, and you can leave it in the comments as well. And I know Condi reads those. And that's about it for us today, Condi. We look forward to seeing you again.
Thanks, Condi.
All right.
Thank you both.
If you haven't already, please hit like and subscribe. That way you make sure it notifies you every time we do a video. My name is Christopher Durham.
I'm Lorraine Durham.
We are the Downsized. Thank you very much.